Dr. Jessica, I have a random question for you.
Okay.
Kind of like an icebreaker a little bit, but if you were stranded on an island and you can only bring one type of animal with you, are you taking a golden retriever? Are you taking a Scottish fold? Or are you taking a capybara?
Oh, that is challenging because I love capybaras and I
Do
just
you
love them.
really?
I do. I'm obsessed with them. Um, I got to
They're
hold
so
one, a
funny.
baby. I got to hold a baby capybara and it was adorable and amazing.
Oh,
Um, um, Probably stranded on an island. I would say golden retriever for utility's sake. Um,
okay. Makes sense.
Anything to to help work and everything.
Yeah, 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 capybaras are they're so interesting, they're so funny too, I feel like it
Yeah.
would just make the days go by so much faster.
It would,
It
but they eat a
would.
lot.
They do, but I see your point too with the golden retriever for the utility. I definitely see that. Hey everyone, welcome back. Today we are pulling back the curtain on the invisible high stakes admin chaos that's happening behind the scenes with vet clinics. By the end of this hour, pet parents will understand the exact legal, the clinical, and the logistical minefields involved in international travel and why a single minor mistake can completely derail your journey. Today, I have Dr. Jessica Duke with me. She's a practicing vet for over 13 years and a pet travel and compliance wizard. She is based in South Florida, which, if you know the area, it's basically ground zero for international pet travel. We have Miami, we have the Caribbean, we have South America, we have Europe, and the volume of travel cases that she sees is on a whole nother level compared to other clinics in the country. And she's pretty much seen everything that can go wrong and probably some things that will keep most pet parents up at night. So, Dr. Jessica, thank you for being here.
Happy to be here.
Awesome. 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 Cool. So to kick things off, by the end of the conversation, what is the single biggest operational truth you want pet parents and the broader vet community to understand about the reality of modern pet travel compliance?
So I think there's 2 big things. One is, we don't have any say in what the country's requirements are. So when you
Mhm,
come in for a health certificate and we're presenting these, items that need to be done or tests that need to be done, like, if you want to go to that country, you have to do those, and you can't decline them and then do the house certificate, and it's not
mhm,
us pushing them, it's that country's regulations. Um, and then the other part is once we submit everything to the USDA, for the endorsement, we also have no control on how fast they approve or don't approve it.
mhm.
At that point, it is again completely out of our hands. And then I would say the last thing is we also, these are legal documents. And so we have to be completely honest on them and truthful. And we can't change dates or change breeds because then it falls back on our license and we could lose
Mhm.
our license for that.
Yeah, yeah, and, I'll touch on that in a little bit, but that's just crazy. It's crazy that, that's even happening in today's world, and that's just, like that's really powerful. That's a powerful, like, stance to have, especially going into these legal documents too, but from that truth, I wanna zoom in a little bit on the operational toll that it has on you and your clinic because the reality is that a lot of that paperwork burden, the research, it doesn't just like slow things down. It really does break down the staff, as you probably have experienced or you probably have faced firsthand. And I just want to take a step back and set the scene for everyone listening because I think most people genuinely don't have an idea on what actually involves with the whole pet travel health certificate process. Most pet owners think that it's just a click up a button and a health certificate is done. And that really couldn't be further from the truth. I mean, we're talking anywhere from 45 minutes to a few hours just on the research alone. And we're not even talking about the exam. We're not even talking about the paperwork filing and understanding each country's specific requirements. So, Dr. Jessica, why do you think this has gotten like so out of hand with vets where you're starting to see some vets refusing to do health certificates altogether?
Well, it used to be a very manual process.
Yeah.
And so we used to have to hand write out all of the health certificates. And then the USDA during the pandemic created this website to help kind of lay everything out as far as
Hmm.
looking up the country's requirements. But, and it helps at some, but some countries you go into the requirement and they have their own document. So then you have to read through their document. You have to understand what they're saying, and sometimes the wording on the timing of things is a little confusing and not straightforward.
Hmm.
Some countries don't even have the documentation, and so then you have to go to their website, dig through
Yeah.
their website to look and try to figure it all out, and that's just trying to figure out those countries' requirements. Then
Yeah.
we have to go to the pet side, look at the pet side and make sure that they've gotten all of their appropriate vaccines. They had their microchip documented before their vaccines. And that sometimes is digging back years of records to do that.
Yeah.
Or it translating records coming from a different country to try to figure out what vaccines they had and the dates and the timing that they had there. And
Hmm.
so the vet is the one that really has to kinda dig through those requirements to understand everything, and then kinda relay it to the technician, putting together the treatment plan, and the technician, generally talks to the clients, like, these are the
Hmm.
requirements they need to do, but then there can be a lot of back and forth because, some clients may say, "Well, I don't wanna do that," and, well, you have to if you wanna go to this country.
Yeah. Yeah.
Others don't realize how long some countries have certain time frames that you have to wait before your pet can travel. And so if they wanna call in like, "Oh, we're going to, Hawaii next week and we're taking Fido." I was like, "Well, n no, you're not." And you
Yeah.
have to explain all of that.
Yeah.
Um, so it is a very labor intensive process, and
Hmm.
then in the hospital, there's, doing fecal tests, reading those, updating the vaccines, or sending out tests. Sometimes when we send out the test, there's a couple weeks to couple months lag on when we get those results back. And
Yeah.
that's again out of our hands. We have no control over sending out those tests. An
Yeah.
appointment with a health certificate generally can take anywhere from 1, 2, or 3 hours in a busy clinic. And
Hmm.
we're also having to see other appointments in and around that, and not
Yeah.
losing track on everything.
I'm just picturing, years back, when there wasn't a lot of technology and services out there where you would have to do a lot of this manually. I mean, just tell me like what type of pressure, what type of stress would be going through a vet's head doing all of this manually, especially with little to no support out there too.
Yeah, so it's one of the reasons why there's kind of this feeling of, like, we don't like doing health certificates because you
Yeah.
had to have whoever in the clinic had the nicest, most clear handwriting, they were designated writing the health certificate. You
Interesting.
couldn't be rushed. If you made a spelling mistake, you had to start all over again. You had to use blue ink to fill out the health certificate,
Wow.
and it's like then it could still kick back if you miswrote the dates. If it's a European country and you didn't write it,
Mhm.
in their order versus our order of the dates, then the client would come back and you'd have to redo the whole thing. Or if you got distracted and misspelled something,
Yeah.
it was very frustrating. You couldn't rush because it had to be extremely legible. And they didn't allow enough space. So you're trying to fit like a microchip number, 15 digit
Hmm.
in a little box. It's like this big and
I
just
see.
write really tiny, but also very legible.
Okay. So if your handwriting is just really bad, don't even bother with health certificates.
You'd have to find whoever has the best handwriting as a
Yeah.
clinic. You would have to then
Guys.
tell them what they needed to fill out.
And again, that just adds another step, more work and more stress involved with the whole process. Something that like you touched on a little bit earlier around the stress that it puts on vets licenses. And you've, Dr. Jessica, you've faced this where clients come to you and they're asking you to falsify official documents, whether that's around their breed, whether that's around their rabies vaccinations. Um, and that's may or may not know this, but you're asking these vets to put their license on the line for their travel plans. So what does that do, on like maybe a surface level and like a psychological level and the pressure for you and your vets?
I mean, it is a little stressful because we care about the animals. We want to help them. We want them, to go with you on your trip. But that's
Yeah.
our license is our livelihood. And if we lose that because we falsified something,
Mhm.
then there's going to be so many other animals that we can't help, and we can't care for. And
Yeah.
majority of vets, you're going to find if you ask them when they knew they wanted to be a veterinarian, is it at an extremely young age, generally 3 to 5. We know, and then we don't waver on that passion because it is a true calling. So we are
Mhm.
very protective about our licenses, because we care so much.
Yeah. Yeah. I'm just curious, at what age did you know that you wanted to be a vet?
Or
4? Really? Wow. Wow. So, what was the one thing or the one event or scenario that just did it for you that like, "Okay, I know I'm gonna be a vet when I grow up."
I kept trying to bring home birds and snakes and
Okay.
cats to rescue and heal them that they were injured.
Aw.
So, yeah,
Wow. You just had it in your blood. Wow,
most of us,
that
it's a true calling for us.
I love it. I love that story. And that just really just shows to like the character that like you bring to the vet role. And also just like platforms, just talking on a lot of the requirements, a lot of the research, like platforms like Cruise Control, where we really handle a lot of the entire pet records, the trip itinerary. We collect all that information. It's parsed, it's verified for the compliance. A lot of that is done before the pet owner even steps into the room. And just from a vet's perspective, I mean, how much exposure and how much stress is eliminated from, that manual data entry part, and the rule checking that is, taken away from your vet team.
I mean, it's huge. Pretty much everyone when I've talked to them about something like cruise control and explaining them what it is, they're like, "Oh, that would be amazing," because
Mhm.
we don't have to worry about that. We know it's compliant. The clients are already educated on the checklist. They come in aware of like what to expect in the
Yeah,
visit, kind of have an idea. Oh, they're going to tell me I need these things.
yeah,
And so it's just one less thing for us to really worry about, and our attention can focus on other items, or other patients that are in the hospital that day and not have to stress over, did we fill out everything absolutely correctly
yeah,
or
and
did we
what
miss something?
yeah, no, yeah, or if you miss something, and there's a lot of, potential human error that goes into that. Has there been ever a moment or a time where the clinic or you had to prioritize one over the other, and one of the other item kind of fell through?
For, like, in regards to health certificates
Health
or for,
certificates
like,
and health
appointments?
certificates and appointments, like surgeries and things like that.
Yeah. So in any clinic, we'll have our appointments through the day and we're of course going to see those in a timely manner. The one thing that will bring everything to a stop is if an emergency comes in. And so if an
Okay.
emergency comes into the clinic, it's all hands on deck and we
Yeah.
stop immediately what we're doing and we deal with that emergency. Or even an urgent care if they're questionable on how stable they are, that
Yeah.
will bring everything to a stop, and then those clients will have to then wait until we get the emergency stabilized, and then we can
Yeah.
return back to treating them.
Gotcha. Gotcha. Yeah, no, and it's for the manual data entry part, just being able to take that off of the clinic's workload, it really, protects their time, gives them back hours, like you mentioned, to really have that
Mhm.
clear head into going into these like surgeries, these urgent care appointments, and just giving back time to the clinic. And I just want to, have a summarizing clarification here because, the perfect clinic workflow, we could do everything right, but then as we've mentioned before, it really does come down to when you get to the country, when you get to the customs agents. And I want to tone in and talk about a little bit about this zero tolerance reality where, sometimes the paperwork reaches the border and things can go wrong.
Yeah.
Because I've faced the same exact pain points. Border compliance is sometimes unforgiving. I've traveled to the country. I got stopped at the border. I didn't have the right documents and things got pretty bad. And, pets can be quarantined. They can be turned away simply because the border agents they decide that they don't have the right document or they're missing dates or the handwriting is ineligible. And it's really regardless of like some of like the typical paperwork. So just knowing about these global borders and how they operate for the zero tolerance for ambiguity. How do you handle these like high stake pressure situations, especially when you guys are filling out these health certificates to ensure that there's not a clerical typo? So when the pet shows up, they're not stopped at the border.
Yeah. So when we're doing health certificates, one, if it's particularly a country that is breed bans,
Yeah.
then if it is a breed that's on that list, then I have to tell the owners like I can't fill out the health certificate, and that
Oh,
they
okay.
can't go. Because and that's where I have had a client that wanted me to say, "Oh no, these, American Bull Terriers are labs." And I'm like, because they wanted to go to a country that was banning them, and I'm like, "I
Yeah.
can't say that," and that circles back to the license.
Hmm.
We're filling out the health certificates, so a lot of clinics will print them out, have the vet review them, and generally someone else is also reviewing them, who's
Okay.
familiar with health certificates, so it's kinda like that double check. Then the 3rd check is actually the USDA. So when we send it off, the USDA veterinarian is then making sure everything is filled out correctly, and then if they endorse it, that's checking everything that they should, saying, "Okay, you've met all the requirements for the country that they've given us and they have notified us for," and
Hmm.
that's really all we can do. Once it's out of the USDA hands and back with the owner and they're traveling, you know, that USDA stamp says, "We've met all of the requirements that this country has set forth."
Hmm.
So if they come to the border and they have a border patrol agent that's having a bad day, unfortunately, that's out of our hands. We've done everything we can, and there's not really much we can do at that point.
I
Also,
see.
because you're in a different country, we have no legality to practice there or amend any documents and then send it there.
Mhm.
It has to be done by a vet in that country at that point.
Has there ever been a situation where, a client did try to blame you, the vet, or the clinic
Oh,
for
yeah.
something that happened? So,
Yeah.
how does that feel, and how do you kind of navigate those conversations?
Yeah, it's pretty bad because then they'll get very upset at us, and they can yell and scream and take it out on us, and you just kinda have to respond in a calm manner to say, "This is everything we did. I'm sorry you're going
Mhm.
through this, but there's nothing else we can do at this point." But it still affects you as a person, like, you feel terrible because you know you've
Yeah,
done your best, you've done your due diligence, you did your research, you compiled everything, the USDA approved it, you did everything right, but it still weighs on you, and as a veterinarian, we deal with a lot of roller coaster of emotions.
Hmm.
And we really have to have some sort of way to let that go and not carry it with us because then it
I see.
compounds.
That's true. And then it would just affect like more of your work with like other clients and other procedures or other appointments. And you don't want that. But yeah, it sounds very stressful. So I definitely tip my hat to every vet and every clinic that handles those high stressful situations and those conversations. Something also too that happens a lot is the microchip sequencing errors. So like or missing a specific country protocol, like China's lifetime double vaccination rule. It's
Mhm.
incredibly easy to miss these when vet has so many other different things going on and they're auditing and doing all of this by hand. With like an intelligent compliance engine that just automatically cross-checks government and airline rules and really flags these timing traps in the pre-staging phase, how does that change the clinic's ability to really handle more of these complex country travel cases?
I mean, it's huge. It would be a massive time saving, tool that we could
Yeah,
use. And
yeah.
then clinics could actually do more health certificates. Or if some clinics have actually stopped doing health certificates because it is so time consuming right now and so tedious and can,
Mhm.
if it goes wrong, emotions are high.
Yeah.
And so it would be another way for them to support people because some people in their area, they may have a clinic no clinic that does health certificates, and they may have to drive an hour to go to a clinic that does a health certificate.
Yeah.
So it would allow more clinics to do that and help people travel.
Yeah, and I mean, that's a very good point too for a lot of different states where they don't have like a lot of different clinics nearby. And they're very limited, for especially the ones that actually could do and complete health certificates. It really opens up this field, this opportunity for a lot of people to, come in and travel with their pet, but also for the clinic to be able to handle that volume as well. Um, and the sequencing traps, I know, that could be very terrifying, and because it's very strict, and a lot of these health certificates, they get rejected and sent back due to that, and sometimes, you have to and nobody really wants to be the bearer of bad news, so I wanna really shift, like, our focus on how we can help educate pet parents before they even book that flight and before they even
Yeah.
book that hotel. Um, right now, from what we've seen, vets are frequently put in this really like impossible position where again, as you've mentioned, they're blamed for a lot, and stuff that they didn't even create, like a sudden disease outbreak or the USDA bottlenecks. So what would your definitive absolute rule for a pet parent, when they should officially reach out to the clinic and start planning an international move or vacation.
Yeah. So when you're starting to plan and you're looking at hotels and you're starting to price out flights, that's when you should reach out to your clinic as well. It should be like one, two,
Mm,
three. You're like you've picked your place. Okay, you're researching
okay,
hotels, you're researching flights. Hey, we need to ask our clinic. And a
okay.
lot of times, the clinic will either have a person, and like most of the time it'll be a receptionist that will then direct them to the USDA's website so that the client can kind of try to get an understanding. Um, or they will again leave a message for a vet, says, hey, this client's going here. What are the requirements? And we have to look it up and then call them back with it. But if they keep that in mind of when they start the planning to reach out to their vet, then you take away a lot of this rushing time crunch and trying to figure out, do we have everything in line? Do we
Mhm.
have our microchip and our rabies vaccine done in the appropriate order? Has it been long enough?
Yeah.
Everything like that. And a lot of the health certificates also require us to give a dose of prevention to treat for intestinal parasites and fleas and ticks. And so if a pet's already on the prevention, when we schedule that appointment for that month, we can say, hey, don't give it. We'll give it in hospital because that has to be done
Mm.
and documented in hospital.
I see. So how just like a general rule of thumb, like how much time would you suggest and urge patients and pet owners to start doing their research and start reaching out to clinics before they even book any flights or any hotels?
It really can depend on the country,
Okay.
because countries that are gonna be rabies free are islands like Japan, and, Australia, New Zealand. They're gonna need a minimum of 6 months prep time.
Mhm. Mhm.
Um, so it would really say, like, 6 months, if not, if a European country, then you could probably get away with 3 months. But it all depends on if we have our microchip done and our rabies vaccine. If that order is not complete, you're waiting a minimum of 21 days after you do that to then be
Mhm.
able to travel. So then that's a month.
Yeah. Yeah. So to get really ahead of, that like crisis mode for like the pet owner and also for the clinic, how critical do you think it is for pet parents to have access to transparent tools like Cruzy AI or digital checklists so that they know all the specific requirements for that country, what the timelines look like before they even book the flight?
I mean, it's huge. It's so important because then it brings awareness to them. They're not getting surprises by when they come into the clinic and be like, "Oh, wait, we have to do this. What do you mean I have to vaccinate again against rabies?" Or, I have to have another treatment for intestinal parasites. It just brings clarity to them. And so then they're walking in and not getting so many surprises on top of trying to make sure they have everything to travel on top of their trip. That's all stressful things individually.
Yeah.
You add it
Yeah.
together and it compounds.
Yeah, yeah. If there's one piece of information that like you would urge pet owners to like really look into or do their due diligence on the research when it comes to traveling internationally with their pet, what would that one thing be?
Having a microchip done before your rabies vaccine. That
Mm,
is huge because if you haven't done a microchip, then most all countries will not count any of your rabies vaccines. You will then have to do the microchip, revaccinate. That is then a primary vaccine. You then have
mhm.
to wait 21 days. Then you can travel and you have to wait, 10 days out from that date is the day that you could travel, the soonest you can travel. So
Mm,
knowing the date and, that you got the microchip or the date that the pet got the microchip and then the date that they got their rabies vaccine can
mhm.
really help clarify.
Yeah, I mean, it's huge. It's massive. And then tell me like a little bit about like the most complicated countries and destinations. For example, like Australia and
Australia.
Hawaii. So, like, what happens and like what would you urge pet owners when
Yeah.
they're thinking about traveling to Hawaii and or Australia or some of those more complicated countries and they already have stuff booked? Like, what would you say to those patients?
So Hawaii is one that people don't really think of because it's a state. They
Mhm,
don't understand it's a rabies-free state, so they are extremely strict on that.
mhm,
I've actually had to tell clients where it came up in conversation for their wellness visit. I was like, "What are how are things going?" They're like, "Oh, we're gonna be traveling soon," and I was like, "Oh, where to?" And they're like, "Oh, we're going to Hawaii in 2 weeks and, Fluffy's coming with us." And I was like, "No, Fluffy's not coming with you." And they were like, "What?
wow.
What do you mean?" I said, "Well,
Yeah.
Hawaii's like going to a different country, and you have to have a rabies
Mm,
titer, and that rabies titer is a blood test that is sent out to a specific lab, and they have
mhm,
to then test for the response to the rabies vaccine. The
Mm,
turnaround time on that test can be anywhere from 4 to 8 weeks.
wow.
And
Wow.
so if you're planning a Hawaii trip, those clients ended up having to get a pet sitter for their dog,
Yeah.
and organizing that. Um, so Hawaii is like a different country. So if you're planning a
Mhm,
Hawaii trip, I would say at least 3 months out from your date, you need to be talking with your vet clinic.
mhm.
Um, and then Australia is minimum 6 months. It's it's a lot of, it's also rabies titer, but then after you get the rabies titer, you have to wait 180 days. From that,
Wow.
you have to be scanning the microchip and noting it at every single
Mhm,
visit in the
mhm,
notes. And then they have specific timing on the treatment for intestinal parasites and endo and ectoparasites, so your fleas, ticks, heartworm. There's very specific timings on those as well.
mhm.
So
Very,
Australia, and that goes for New Zealand as well. Same
very,
same boat.
very strict. Yeah.
Very strict.
What's one destination that maybe some pet owners don't know that it's extremely hard or complicated to travel to?
Um, uh, I mean, maybe Japan or Israel is a little bit complicated.
Mhm.
Turkey, they have some breed bans,
Yeah.
and they're pretty strict on those. There are some countries that where they define it as having characteristics of the banned breed. And
Mhm.
so then you're kinda at the whim of the border patrol or border agent. If they deem that your pet has characteristics of this banned breed, then they can turn you away.
Yeah. Yeah. And I mean, and that's unfortunately why, again, I pet owners are coming to vets and they're asking them to falsify some of those documents, which is just it's just insane. It's just insane to me. And again, it's just the to sum all of this up, it's really just showing the importance of the transparency, the early planning really creates that safety net for not only the pet owner and the pet, but also the clinic too. Because it's so important. It's so important. It's not a last minute thing that you can do, when you're
No.
looking to either travel or relocate with your pet. But Dr. Jessica, I want to distill pretty much everything that like we've discussed today into just a single undeniable takeaway for our listeners. Typically, what we do, we close on this question for a lot of our media clips. If you can just broadcast just a single 12-second headline rule for every pet lover planning a trip abroad this year to ensure that their pets and them and their vet stay sane through the whole thing, what do you think that headline would be?
Go give yourself ample time, and we're your vet's not your enemy. We're working with you. We want to help you travel. We're doing everything in our power that we can, but there's also some things that are outside of our control. And just being
Mhm.
understanding and having a little compassion when those situations may come up.
I love it. I love it. Dr. Jessica, do you have any travel plans coming up?
I do, but I don't travel with my cats because they are seniors and it would be a little too
Aw.
disruptive for them. But maybe our next future fur baby will be more of an adventure pet.
There you go. There you go. Well, I can't wait. I can't wait for that time. But I know your cats would definitely, they would love to be there. But yeah, no, Dr. Jessica, this has been great. Thank you really for just sharing your honest reality of just like how vet compliance is today. For parents listening, save your vet some major headaches by visiting cruise.co to manage your travel timelines. And for the vet teams looking to eliminate that manual data entry, typing, and the research entirely, check out the tools built for your dashboard at cruise.co/vet. And again, that's KRUIZ.co/VET. Thank you so much, Dr. Jessica. Really appreciate
You're
your time.
welcome.
And
Thank you
everyone,
for
we'll see you
having me.
guys. Thank you. We'll see everyone next week. See ya.